A new report by the U.S. Surgeon General finds that loneliness can be as deadly as smoking. The report from the office of Dr. Vivek Murthy shows that about half of U.S. adults say they've experienced loneliness. It says that widespread loneliness in the U.S. poses health risks as deadly as smoking 15 cigarettes daily, costing the health industry billions of dollars annually. Dr. Murthy says loneliness is like hunger or thirst and causes the body to send signals that something is needed for survival. Research shows that Americans who have become less engaged with houses of worship, community organizations, and even their own family members in recent decades have steadily reported an increase in feelings of loneliness. Joining us now to give us more insight into this research in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome to Forum Daily.
Thanks so much. Great to be here.
So it is surprising that loneliness can have the same impact on your health as smoking 15 cigarettes a day. So can you tell us a little bit more about similarities in symptoms between loneliness and smoking?
Yeah, it certainly is interesting, and it's good that we're having this conversation on the forefront there. But loneliness really can affect behavior very quickly. If you're suffering from loneliness, you might have alterations in that behavior. You might not seek care. You might not reach out to people for help, and you may not engage in normative community behaviors that are very helpful for mitigating things like cortisol levels. For instance, going for a walk to see your friends. So, across several decades, we've seen in various scientific disciplines that people who are socially connected tend to live longer. And what we do see that people who experience these social deficits, including isolation, loneliness, and poor quality relationships, tend to die earlier, regardless of the cause of death.
And I think it's interesting that you mentioned that I might consider loneliness a feeling. So how can a feeling like this have such an impact on overall health, even leading to premature death?
Right. I mean, it's an excellent point. I think what we see in the data and the literature is that even this feeling of loneliness can cause significant health outcomes there. Let's take an example for, let's say, high blood pressure. What we find in the literature is that if you have greater social support in a group, you're associated with about a 36% lower risk of high blood pressure in the long term. And that could be because of several outcomes, including behavior. So those feelings do drive outcomes. We see the same thing in diabetics as well. Those who are more socially connected might have better outcomes because of diabetic management behaviors and self-care, medication adherence as well.
Fascinating. I suppose the question that I have here is, how long does it take for a person to experience health issues from feeling lonely? What is the timeline that we're looking at typically?
Right. I think we see the results pretty quickly. We have a lot of data supporting that, the community support and household support is really key towards getting the care you need when you need it. We all know that family member who may have refused to go to the doctor until you really push them. But imagine if you weren't there at all as that support. So those are the people who can have worse outcomes very quickly if they don't have those supports around them.
And parsing it down here, family members and whatnot. What about demographics associated with this research? Does the loneliness have different impacts on younger people versus older people? Is it the same? What is there a breakdown in the demographics?
Yeah, so we are seeing some breakdowns here. What we do see is those who are highest affected, those tend to be people with poor physical or mental health, with disabilities, or even financial insecurity. Those who live alone or single parents as well. There's some interesting thing between younger and older populations. So high rates of social isolation is found in older adults, but young adults are almost twice as likely to report feeling lonely than those over 65. And in fact, that rate of loneliness in young adults has increased every year from 1976 all the way to 2019.
Wow. Well, that's a very concerning statistic indeed. So I suppose just a minute left here, but following 2 years of pandemic lockdowns and restrictions, what sort of impact has this had on Canadians when it comes to feelings of loneliness and their health?
Right. I mean, this issue has definitely been exacerbated by the COVID pandemic, and it's caused many people to reduce the size of their social circles. I think one of our studies quoted that in the report, there was a 16% decrease on average in social network size of the participants when we looked at 2019 to 2020. So a huge decrease with the pandemic.
15 seconds here. Doctor's diagnosis. How can people avoid being lonely? How can they embrace a more social structure?
I think that the best thing to do is just force yourself to that activity. Pick up the phone, give someone a call that you haven't talked to in the last 3 months, and I think that's going to just help even that little bit of an extra step to rebuild those social connections.
Well, Dr. Raut, that is helpful advice. Thank you so much for joining us today on Forum Daily. We appreciated your insight today.
Thanks so much for having me.